Few minutes left here on Open Line. We're talking about Nashville General Hospital and what is the city to do. We have callers on the line I want to get to. Reese has been hanging on for a while. Reese, thank you. Welcome to the show.
Hi.
Go ahead.
I just have a comment. Dad, he spoke so articulately and eloquently, and he voiced all of my feelings. But what I had to say was the situation is nothing more than land acquisition. They want the land. These numbers they're throwing around and all these things, that's just a diversion. They want that land, period. And that's the reason this is happening.
No doubt it's very valuable. Yeah. All right, Reese, thank you for watching, for chiming in tonight. Before we run out of time, Decosta, I want to know where the ball is right now. What is the next step? Because there's funding that needs to be approved, kind of emergency funding to keep this hospital running.
Yeah, well, that's the thing. If we would have in the beginning approved the funds, that $55 million, we would not be here. Okay, but we are. But we are. And what needs to be done is that we need to approve other funding, but that's not going to be done just like, you know, right away. The mayors, the administration has no answers. They don't have a plan, and that's why we're thrown off the wall, because you come with no plan, but you come up with context of saying that we need to close something down. We need to do that quickly. Honestly, I have nothing else to give right now because they have nothing.
Right. She held a press conference. She said, here's my idea. And
that was it.
Okay.
That's it.
Yeah.
Yeah, that was it. The financial guys that work with the mayor's office, nothing. They had nothing for us.
It was a very much to be continued.
Yeah, I don't know. Yeah. It was a Jeff Sessions type of interview.
And the mayor eventually apologized and said, because of some other deals that were working, I had to come out with this, and here we are. So it's something that we're watching closely as a news station. I know you're watching it closely because of your position on Metro Council and also on the board, the committee. Yeah. Let's see if we can get to one more call before we have to go. Lucy is on line one. Lucy, welcome to the show. I know you like to call in, very knowledgeable. We don't have a lot of time, so go ahead.
Okay, I'm going to say I've been to Meharry. I've used Meharry over 45 years ago. I had great insurance. When I had great insurance, the hospital kept me in the hospital running tests on me all summer long, and it was not Meharry. It was a hospital that the rich went to. When I no longer had that insurance, I was going to the ER with 106, 107 degree temperatures. They shoot me with penicillin and send me out the door. Meharry took me in to try to find out after the fact of what was going on. When I got good insurance again, they put me in the same hospital. Come to find out, that's the hospital that had given me septicemia that I had been battling for 3 years. If anybody has ever read the book Fiddles and Fried Chicken, it goes into Vanderbilt and how they were against this hospital for profit, okay? Vanderbilt, from what I understand, has quit taking Medicare patients. From what I understand, Summit Hospital is the TennCare contractor. Is that true or what? I'm going to hang up and take your comments off the air. Bye-bye.
All right. Thank you, Lucy. Can you add to any of that?
Honestly, I have no idea about that. Honestly, I don't know. I don't know that.
All right, Lucy.
So, yeah.
Sorry we can't answer that.
Yeah.
You know, this is not, and I think it's very easy to make this a Nashville General versus Vanderbilt, or Nashville General versus St. Thomas, or Nashville General versus all the others. Yeah. But really, it's about what Nashville General does for our community and its purpose. And as you said, it's in the charter.
Yep, it's in the charter. That is what we have to do, and that's what we're supposed to do. And by all means, I need to make sure that we do what's being done, and that's the reason I was elected, is to make sure that people in the means of the city is taken care of.
What do you want to see happen from here?
Well, first of all, we need to go back to the drawing board to take care of the subsidy of what we should have given the hospital in the beginning during the funding period. We need to take care of that, number one. Number two, we need to get some things together to make sure that the back end of the back office of the hospital is taken care of, and that we do things appropriately and we do them the right way, and the funding for the accounts payable or whatever that's going on, that we start to get the assets so the hospital is taken care of. And then after that, we need to again fund the hospital appropriately to where it can take care of the people and utilize their dollars to make sure that their health care needs are taken care of.
All right, we're going to take another quick break as we close on that topic. We'll be right back. Stay with us.